Hi, my name is Dr. Rudra Mohan, and through the Oral Health channel today we're going to be talking about the difference between gingivitis and periodontitis. Let's start. So today's episode is actually very interesting, where I'm going to be talking about the fundamental difference in layman language and simple terms for you to understand what is the essential difference between gingivitis and periodontitis. Now, periodontitis was also known as pyorrhea before. Gingivitis is basically gum infection and gum disease that is just restricted to the gums, the level of the gums. Now, surrounding the tooth, there are structures such as gums, the bone, the alveolar bone, which houses the teeth, and the periodontal ligament. Up until the point that the infection of the gums is just restricted to the gums, it's known as gingivitis. So as long as the infection of the gums is restricted to the gums, it is known as gingivitis, and it has various plethora of symptoms and signs such as bleeding on probing, such as bleeding on brushing. That's one of the biggest complaint that we get across. They see a little bit of spots on the in the sputum when you're brushing your teeth, and then you spit it out. Also, you can have itchy gums. On top of that, you can have swelling of gums. You might also have some sort of pain or burning sensation in the gums in some cases. But let me tell you, till the fact and till the time the gum disease is restricted to the gums, it's known as gingivitis, and this can usually be done or taken care of with the help of scaling and intervention by the dentist along with home care regimen. When does gingivitis progress to periodontitis? So once the infection reaches, because of the food and the debris and the plaque and the bacteria and the biofilm of the bacteria that causes these problems such as gingivitis, once this level of infection reaches the bone and it starts to eat up the bone, it starts to cause a reaction in the bone, it starts to cause the deepening of the gingival sulcus, that is the trough between the gums and the tooth. This is usually 3 mm when it's in health, that is around sulcus depth, which is known as the gingival sulcus. Once it gets deepened because of the disease process, I don't want to get into the science. Basically, the food gets lost, the bacteria, they act on it, the body thinks of it as an attack, and it attacks the bacteria to make sure that it is eliminated, and thereby, because of a two-edged sword effect, it basically compensates with the help of the deepening of the gums, which is known as periodontal pocket formation, and after some time it leads to the loss of the alveolar bone support, because of which you understand that the gums start to recede. Either in depth they become deeper, or they start to recede otherwise, which is known as gingival recession. You get more bleeding on probing, you get more bleeding on brushing, you also get exudate, which is pus, you get pains, sometimes in abscess formations, and you have to understand that with the bone withering away at a rate faster than its repair, ultimately it leads to tooth loss. You have to understand that. Now, periodontitis is actually a lot of things in terms of symptoms, in terms of diagnosis, but all I have to say in general is that if you want to really differentiate periodontitis from gingivitis, it's basically if it's gone to the alveolar bone and that there has been a pocket that has been created, then it becomes periodontitis. And we have different tests. We have bleeding on probing, clinical attachment level, and the therapies also include plaque control, not only just at home, scaling and root planing, flap surgeries, even LANAP and laser-like procedures, which are the discretion of the dentist or the periodontist who wants to do the treatment for intervening and stopping the bone loss to happen from further. Now, for you to decide if it's gingivitis or periodontitis, that's not something that it should be your prerogative. As long as you're having any sort of symptoms or signs such as bleeding on brushing, wobbly teeth, any sort of exudate or abscess or pain in gums, or burning or prickly sensation in gums, or itching in gums, you must refer yourself to a periodontist or a dentist, and then they can see it and they can do a periodontal evaluation and then probably go for your treatment. So this was today's episode. Please like, share, subscribe, and do press the bell icon button for important updates. If you want to get in touch with me, here are my social media handles. Kindly refrain from calling me directly, as I might be busy with patients. Just drop me a message with your name, your location, and the common oral health problem that's giving you discomfort, and then we can have a dialogue on WhatsApp. Otherwise, you have my social media handles, and please make sure that if you have any queries, doubts, apprehensions, or insights, please feel free to put them in the YouTube comment section. So that's it for today. Thank you.